welcome back to FACEit with Dr. G. I'm Dr. G, and I'm so excited to have you guys back again. We are just going up and up and up with downloads and subscribers, and it just fills my heart because this is so much fun, and I love you guys coming up to me in public and saying, oh my gosh, I listened to your podcast. So today I want to talk about an interesting case of a patient who has consented to me discussing her case. There are no identifiers that are going to be discussed with her. And it's about Kybella, or deoxycholic acid. And deoxycholic acid is a natural substance in our bodies that digests fat, dietary fat. And we now have a synthetic version of that. It's called Kybella. And many of you that are injectors probably use it in your practices. If you don't, you can maybe learn something a little bit about it today. And I don't know if it'll make you inject it or not, maybe not. But deoxycholic acid, or Kybella, is FDA approved for specifically the submental region to dissolve fat cells. You can use it off-label all over the body. I like to use it in the jowling of the face. You can use it in the legs, specifically cankles. You can use it underneath the buttock in those jelly roll lines. You can use it in the arms. You can use it pretty much anywhere there's fat, but you just have to understand what some of the secondary developments may be. I wouldn't call them adverse reactions or effects, but anytime you dissolve a material that's there, that material can have structural purposes, and you may see that there is an effect, right? Cause and effect. So we had this patient come into our practice in January. I'm not sure of the exact time frame, but you guys are going to get the idea. So about 5 months ago, and she was concerned with some fullness in her submental, or below her chin area. She was thin and fit. She is thin and fit. She's in physical therapy. She's kind of in the medical arena, and aware of it, she wanted to have a little bit of a slimmer jawline, profile-wise and from the front. So we injected her with 2 vials of Kybella in the submental fat region. Everything was perfect anatomically. All of the landmarks were identified, and it was injected right into that submental fat. She developed the regular side effects that you would from this injection. A little bit of swelling. She was swollen for a couple of weeks, I think almost a month. A little bit of tenderness. Some other side effects that she didn't experience you can have are numbness, tingling. You can have hardening of the area, which she did not have. And you can have temporary nerve irritation, which can affect the smile. So I like to assess patients' smiles before I inject them, take photos, and just let them know it's temporary. It will resolve and it will be just fine. So she had this swelling, and then several months later, it was about 5 months later, reported more fullness in her submental region. It wasn't hard, it wasn't tender anymore, and it wasn't numb or tingling, and there were no other abnormalities, but she felt, specifically when she would touch it, it would jiggle, and it felt fuller, and she felt like she looked worse. And there was a lot of back and forth. She is traveling kind of back and forth between several different states, so it was hard to get her into the office, which I think is another whole issue that I can do a podcast on. But it was hard to get her into the office. There was a lot of email communication and phone conversations and before and after photos sent back and forth. And the best and gold standard is to see the patient in person. And if that's seeing them over Zoom or having them come into the office, it's so important. And obviously we're always here and we want to talk to you guys, but you can't see through the phone. Which you could, I guess you kind of can with FaceTime, but it's better to see the patient in the office. So we had her come into the office, so happy to see her as a team. We used this as an educational experience, and everyone listened to how Krista and I digested her presentation, her symptoms, and we listened to her. And she said exactly what I just discussed, that she had been feeling all of these symptoms, felt like she looked worse. So I then started asking her more questions, and this is where my pathology-trained dermatopathology brain comes into play. I like to get all the pieces together and then formulate a plan. You know, maybe it's not exactly the answer right away, but we need to determine the steps, and I love these types of complicated cases. So she reported a lot of stress recently. She reported she was dealing with stress in her life personally, professionally. She recently had, I specifically asked, she had some acne on her chin. And so she's had some cystic acne breakouts on her chin. And this was relatively recent, in the past couple weeks. And she was put on doxycycline. And I think she was supposed to be on it for about 4 weeks. So now in my mind, I'm saying there's some inflammation in her lower face, specifically her chin area and lateral chin, which when there's swelling in that area, you can appear more full in general. And as I palpated around her chin, I felt several lymph nodes. And I said, have you been sick recently? She said, no. Actually, yes, I did. I don't know if I was sick, but I had some tingling in my ears. I felt like my ears appeared full, felt full. And then she had this cystic acne situation going on. So her body right now, in my mind, and just getting all the pieces together, is there's some sort of baseline inflammation going on in her body that when that happens, your lymph nodes are involved and you have drainage to those lymph nodes, which can cause swelling and tenderness. So not blaming that, just putting the pieces together and discussing this out loud with her. And then I said, have you had any other injections? Because my goal for this appointment was not to then inject her to resolve this situation. It was to get the facts so that we could make progress, but not necessarily to inject her at that visit. So I said, have you had any other injections recently? And I said, specifically, do you clench your masseters? And she said, oh my gosh, how did you know? And I noticed that her masseters actually looked pretty atrophic. So they looked like they were lacking support, as though she was a post-injection patient. She said, yes, I did inject my masseters. I clench a lot and I inject my masseters. And I said, when was that? And that was in between the time frame of when we saw her for Kybella and when she came in reporting this fullness. Again, not directly correlating it to how she feels now, but gathering the information. And I said, when we inject the masseters, you have to weigh the risk versus the benefit. The benefit is obviously symptomatic relief of tension, headaches, clenching, saving your teeth from that grinding and potentially breaking your teeth, and alleviating back pain, spine pain from all of that grinding and tension in your mouth. So that's the downside, or that's the positive. The downside is then making your masseters weaker and therefore thinner, and they're less supportive. And when you have less support in the masseter area, you then can inadvertently gain a little bit more perceived fullness in the lower face, in that pre-masseteric region, so the lateral chin area and even submentally. So I've mentioned that to her, and the conversation was fluid and really beautiful in the sense that there was no blaming of anything. I just wanted to know, again, all the pieces. And I hope my purpose for this podcast, YouTube, is to go through my thought process with you, because if we don't gather these facts, we automatically assume responsibility, and we do here, what is it that we could have done, but what else is going on in your day-to-day life? So this is the insight into my brain. So we then ultrasounded her, and that is where ultrasound is so powerful. I don't have to guess anymore what is going on under her skin. I don't have to guess if there's inflammation or if there's fluid or if there's lymph nodes. Obviously, we can feel some of those things, but I can see directly what is happening. So we got out the ultrasound, analyzed and identified all of her anatomic muscles, the fat pads. We noticed there was some extra fluid accumulation in her superficial layers of her skin, and that she had some skin laxity. Her superficial fat pads, so her subcutaneous fat, was thinner, and there was some fluid. So there's a combination of fluid, less support with that fatty layer, which then can lead to a little bit of skin laxity. But there's blurred lines here, and I don't know what the exact answer is. So after identifying all of her anatomic features, looking at the vasculature, confirming and reassuring her that there were no issues, that everything looked great, we decided to discuss a plan. And I said, how long are you going to be on your antibiotic? And she said, I think 2 more weeks. I said, great. I want you to finish your antibiotic. Let's let your body de-stress itself. Let's get all of that inflammation down. get you off that medicine, and then I want to hear how you're doing. I want to hear if you still feel swollen. How does it appear to you? Do you have numbness, tingling? Has anything changed? And then probably have her send me some photos if she's not local. I said, let's address it then and see how you're doing. If you still feel swollen, we discussed putting her on a low-dose steroid to see if there is still some inflammation there that we can cause to decrease. And after that discussion, then I want her back in the office to re-ultrasound her to gain some more insight. So there's not really, it's not that there has to be a definitive treatment. The treatment is the plan, and we are discussing and making this plan so she knows, first of all, we're taking care of her. We're in this with her throughout the entire journey, and we'll be here for her to address it. The end result then, let's say she still isn't happy, she still feels like she's too full. We discussed not injecting her masseters, and we also discussed using a product that would simulate bone to create structure back in her preauricular area in the posterior jawline or the gonial angle to give her that support so that her skin feels more stretched out and supported so she doesn't feel full and heavy. So that's that. We still are waiting to hear from her. She's probably finishing up her antibiotics now, but I wanted you to hear how I went through this interesting case, how I utilized my knowledge and my team and the ultrasound to tackle patients that have complications that maybe, or results they aren't happy with, that we can treat you, and we're here to do that. But also understanding everyone's human, and the body is the body, and the body will do what it wants, right? We can inject you with materials, and that's why we give you informed consent, because we predict that it's going to do what we want it to do, but you just have to be aware that sometimes things happen that we can't control. So we will update you maybe with a little brief podcast about her treatment plan and how she's doing. I would love to hear all of your comments and questions, concerns, experiences with Kybella. Do you like it? Have you used it? Are you interested in using it? Have you had similar experiences? I hope this was great for you. And if you're interested in learning more about ultrasound, how to incorporate it into your practice, the business aspects of it, getting experience and hands-on experience with all of the different ultrasound companies and integrating that and combining that with live anatomy, head over to FACEitlive.org. It's a beautiful conference that we are putting on right outside of Boston in Cambridge, Massachusetts in December 1st through 3rd, 2023, and we'd love to have you.